So again, just to let you know, this is Decolonizing Dermatology Part 2, Representation in Medical Illustration Matters. This is the agenda for today. So today we will be just focusing on some housekeeping things. So that would be introduction, importance of diverse representation in dermatology, debunking common myths about dark skin, conditions that are common in people of color, presenting guest speakers. So today we have the amazing Chidiebere Ibe with us. And he's going to share very important information with us. Then we will be having Q&A session. Then we will be sharing you some additional Pyramid Foundation resources, events, and opportunities. So we will be doing our land acknowledgement first. We would like to acknowledge that the Pyramid Foundation is situated on the traditional, ancestral, unceded lands of the Haudenosaunee Confederacy, and more specifically on the lands of Mohawks. The colonizers that initially settled here on indigenous land committed acts of genocide and ethnic cleansing as they stole the land of Haudenosaunee and other indigenous peoples across Canada. And the Canadian government continues to commit genocides that the people attending these workshops genocide to this day. More broadly, we want to acknowledge that the people attending this workshop are meeting across all 11 treaty territories in Canada. The Pyramid Foundation is dedicated to doing its part to facilitate the healing of Indigenous peoples and communities across Canada, as well as the achievements of health equity for Indigenous peoples, and encourages everybody attending this workshop to reflect on the past and the present circumstances of Indigenous peoples, as well as what we can each do to help these communities. We also have our diversity, equity, and inclusion statement, zero tolerance policy towards racist, homophobic, transphobic, and sexist attitudes and other discriminatory behaviors. Through this workshop, we hope to provide a safe space for diverse voices to be heard, educated, and empowered. We do have some ground rules that we expect you to keep in mind. This is a very safe and open space for you to share or not share your thoughts, feelings, and experiences. Negative, hurtful, or discriminatory comments will not be tolerated at any point. You can always choose to pass if you're not comfortable speaking. So we want to get into the presentation now. We want to start with this important information. Just before that, in our dermatology workshop part 1, we had been discussing some very important information regarding health inequities in dermatology. And I do want to bring up some very important topics to give a recap before we look at the new and interesting concepts for this workshop. We do have our amazing guest speaker along with us today, Chidiebere Ibe, and we want to welcome him as well. People are still attending. Just give me a minute. All right. So just so you know, 1/3 of American doctors believe myths about Black patients, such as notion that Black people have thicker skin with fewer nerve endings, is true, which is very traumatizing, but it does, and it does happen even to this date. So with that, we want to get into our second part of the workshop, which is the importance of diverse representation in dermatology. So in dermatology, where images are critical for diagnosis, the lack of images of darker skin poses a roadblock to proper treatment and medical education. The assessments of and quantification of skin color is important to healthcare. Color is an indicator of overall health, and is linked to oxygenation, tissue perfusion, nutritional status, and injury. Clinicians make decisions based on color assessment multiple times each day as they gauge tissue perfusions and assess for jaundice, pallor, cyanosis, and the blanch response. Thank you. If medicine does not decolonize its curriculum and teach students to recognize signs and symptoms on darker skin tones, there will be delays in diagnosis or misdiagnosis. Skin conditions that involve redness or pinkness in light skin can be subtler or harder to see in dark skin, and physicians who haven't been adequately trained with such images are prone to misdiagnose, people of color. So this is the topic for today's presentation. And skin protection and the prevalence of injury have been reported in the literature as varying across population. Investigators describe differences in injury, patterns, types, severity, and number between people of different races and or ethnicities with respect to sexual assault, childbirth-related injury, pressure, ulcer formation, and healing. Differences in melanin may affect sunburn and skin cancer risk, which we will go over later in today's presentation, as well as synthesis of vitamin D, levels of which are associated with a number of positive and negative health implications. With respect to protection from sun and other UV exposures, light-skinned individuals have been documented to have an increased risk of skin cancer compared to darker-skinned individuals. Darker-skinned individuals, on the other hand, have an increased risk of decreased vitamin D levels, which may affect risk for multiple chronic conditions, including cancer, autoimmune diseases, and cardiovascular disease. Teaching regarding protection from sun should vary based on the needs of each individual, depending at least in part on skin color. Those with dark skin are not immune to sun damage. At the same time, clinicians should be attentive to the increased potential for vitamin D deficiency among those with dark skin, so as to balance skin protection, sun exposure, and potential supplementation to address deficiencies. Clinicians should note differences in early signs of skin breakdown among those with lighter versus darker skin, while patients with light skin may have the blanch response that demonstrates adequate tissue perfusion. Dark-skinned patients rarely have the same response to light skin pressure. Thus, it may be difficult to determine when dark-skinned patients are at risk for pressure ulcers. For patients with dark skin, pressure ulcer assessments includes applying light pressure and looking for an area that is darker than surrounding skin or that is taut, shiny, or indurated. I am extremely sorry for the participants. I forgot to introduce myself. I am Saturitika, for those of you who were asking. My name is Saturitika, and I currently go to McMaster University. I am part of the PeerMed Foundation. PeerMed Foundation is a volunteer youth-led international not-profit organization that is committed to health equity, inclusivity, and diversity and racial justice in medicine. I am the Assistant Director of Education. The Director of Education for today did not show up. Her name is Anna. She does most of the introduction material, so that's why I'm not really used to it. We also have Leah today with us. She is the founder and executive director of the PeerMed Foundation. And as I already mentioned, we also have our guest speaker for today, Chidiebere Ibe, and he will be presenting an amazing presentation today as well. So for those of you who wanted to know, I'm sorry about it. I should have done that in the beginning. Debunking some common myths about dark skin. So this one is, it overlaps with our first workshop on decolonizing dermatology. And we will be covering some of the material to give some recap on some of the common myths about dark skin. For those who did not show up before. So the first myth we have on the screen is that the dark skin doesn't need sunscreen. We'll see why that's the myth. Like any other skin tone, black skin does need to apply a minimum sun protection factor 30 for protection against UVA or UVB rays. Although dark skin already has a head start with sun protection due to the melanin, it isn't really enough to rely on this alone. And without adequate protection, dark skin is prone to diseases like skin cancer as well. Maybelline New York Dream Urban Cover Foundation exists. So while some sun protection factor foundation formulas are notorious for leaving slightly a white cast on dark skin, that is not a reason to skip it at all. Again, Dream Urban Cover Lightweight Flawless Coverage Foundation offers a sun protection factor 50 protection that doesn't have that chalky cast on deep skin tones. So that's our first myth. Then we also have our second myth, that is dark skin can't have advanced treatments like laser and chemical peels. This is truly a myth. We'll see why. Yes, it can have this advanced treatments as well under careful guidance of an experienced practitioner, using the right equipment and products. Technology is now very well advanced, and there are many treatment options open to all skin tones, which is very fortunate. Skin of color has an increased melanocyte or melanin-producing response. Therefore, we must avoid the absorption of laser energy by the pigment in epidermis. The safest technologies are long pulse lasers or fractionated devices that protect the pigment in dark skin. Much like with chemical peels, it is important to start with conservative setting and slowly increase to avoid any unwanted complications. We have our last myth, or like we have more myths, but this one is more in depth, which is that black don't crack. This is a very old adage that black skin doesn't show aging. Example, fine lines and wrinkles as early as Caucasian skin tones. While there is some truth in it, black skin does still show aging in the skin through a more mottled appearance, plus hyperpigmentation, age spots, and etc. Dark skin ages, but it just shows up differently. Although darker skin may show signs of fine lines and wrinkles at a slower pace than lighter complexions, in part thanks to sun protecting melanin, that doesn't mean it is immune to aging. Aging in dark skin causes skin laxity or sagging, as well as dark spots and the growth of small moles on faces. Adding a skin tightening serum to your regimen well before you see the first signs of any lines or looseness can help skin looking young. So here we have some additional myths that women of color don't need anti-aging skincare. This is truly a myth. Hyperpigmentation is irreversible. Dark skin is less sensitive than fair skin. Hydroquinone is unsafe ingredient for people of color. These are all some additional myths that we see in the dermatology field, and that's the reason we wanted to debunk these common myths in today's presentation as well. Next, we will be moving on to conditions that are common in people of color. So here I will be presenting information about 4 common conditions, including hyperpigmentation, melasma, keloids, and also vitiligo. So first, we will be starting with hyperpigmentation. Hyperpigmentation, to introduce what that is among the most common types of pigment problems in dark skin is post-inflammatory hyperpigmentation. This really occurs as a result of skin injury, such as a cut, scrape, or burn, or in conjunction with eczema or acne. The darkened skin area can take from months to years to fade, though medical treatments can definitely help. Those with sensitive skin are at greatest risk for pigmentation problems, and any skincare product ingredient that irritates or dries skin increases risk. So in people with lighter skin, product-related irritation normally subsides once use is discontinued. But then in people of color, the irritations often give way to post-inflammatory hyperpigmentation. This can develop within 1 or 2 weeks after stopping the product and and can linger for several months or longer. Post-inflammatory hyperpigmentation affects over 60% of people of color. Now, I have listed some of the treatment methods, and I will be now going specifically into them. There are specific products formulated to lighten dark spots and inflammation on skin of color. A lot of basic treatments like topical antibiotic cream or gel for acne help with inflammation. This is the very first step. When women of color notice they are having issues with acne, they should treat it more aggressively so that they are not left with dark marks. To get rid of dark spots, there are certain medications that are focused on breaking up and exfoliating pigments, like over-the-counter retinoids and retin A. We also have Finisher is a phenomenal for helping get rid of pigment associated with acne. You can consider traditional bleaching creams to get rid of hyperpigmentation, like hydroquinone, which is very safe to use as long as it is not abused and over bleaches your skin. There are also tons of natural alternatives to lighten dark spots, like vitamin C, which is proven to break up pigment for skin color and slow down the aging process. Meleclear from Isdin contain vitamin C and phytic acid, which works like a miracle for hyperpigmentation as well. We also have True 4-Day Serum that is awesome for sensitive skin dealing with hyperpigmentation. But as we always mention, be wary of products with super high percentages of acid for excessive inflammation. Women of color are more prone to scarring and dark spots with these, therefore just be careful. Daily use of sunscreen will help keep a pigmented area from becoming darker. Treatment procedures include removing layers of skin via a chemical peel and prescription bleaching treatments. These treatments won't work on pigment deeper in the skin. Microdermabrasion procedures have also proven to be effective for hyperpigmentation as well. Chemical peels chemically break up skin pigments, whereas microdermabrasions mechanically break up skin pigments. Newer product procedures that are known to help include microneedling, which is a set of needles that lightly puncture the skin to simulate collagen production and physically break up the cell's pigment. You can also consider a mild laser treatment to break up your skin's pigment. So this is some of the common conditions that can be found among dark-skinned people. And we will be moving on to the next condition, which is melasma. If you didn't know what melasma is, it is a skin condition commonly seen in African American women between the ages of 20 and 40. Typically presents with symmetrical brown blotches seen as an irregularity within the facial pigmentation, can cause embarrassment, but it is not painful and can easily be treated as well. And we have listed some of the common treatment options. Patients can often achieve improvement with over-the-counter hydroquinone creams, and also there's numerous prescription products and professional treatments available for more severe cases. Some of the more advanced professional treatments may include advanced topical hydroquinone combination treatments, oral medications, and microneedling. Sunscreen is the backbone of treatment for this condition. So always it is recommended that you use sunscreen regardless of dark skin or not. We also have the next typical condition called keloids. Keloid is a scar that forms beyond the boundary of a wound that develops to become thick, fleshy, and raised. Keloid develops after trauma to the skin, which can be caused by a range of factors, including acne spots, piercing, surgery, blisters, minor injury, and vaccinations. If the healing of scar resulting from a trauma is abnormal, it can spread well beyond the original site of trauma to form a keloid. The scarring occurs due to an overproduction of collagen, which is the structural protein of the skin. In African Americans and Asians, the fibroblasts and healing cells are often disobedient. This makes hypertrophic scars and keloids harder to get rid of because our healing process never stops. It just keeps on going. So anytime dark skin is injured in certain areas, there is an increased risk for keloids, a scar that spreads beyond the boundary of the original injury and develops into a growth. So it is a little bit of a traumatizing condition, I want to say, because your skin naturally wants to heal, which just makes the condition worse. Unfortunately, there is no conclusive treatment pathway for keloids. The very first therapy is avoidance of inessential activities that cause trauma in individual genetically predispositioned to keloid or hypertrophic scarring. For example, ear piercing, whether that be tattoos, cosmetic procedures, and etc. The very first step would be just to avoid them. Surgical removal is an option, especially for bulky and uncomfortable keloid. However, the healing of the skin post-operation must be monitored carefully, as keloids have a habit of returning. As I mentioned, there's also the risk of pigmentation irregularities occurring in the area that has been treated, which is also very undesirable. Now, as mentioned here, corticosteroid injections, creams, tapes also have shown to be beneficial effect in treating keloids. There is emerging research investigating combination therapies are highly effective in removing keloids, including the use of surgery, whether that be radiation, again, steroid tape, plaster, all of which provide the individual benefits of mass reduction, commonly seen through radiation and surgery, and anti-inflammatory activity, which is more specifically steroids. So that was our next condition that is very commonly seen in dark-skinned people. We have the very last condition that I want to discuss today, which is vitiligo. What it is skin depigmenting disorder that usually occurs due to the loss of melanocytes. Melanocyte is a pigment cell that produces melanin. The main symptom of this condition is a large patches of milky white skin that can appear anywhere on the skin, can affect women and men and those of any race, but it is most noticeable and stigmatized in those with dark skin tones. Usually it begins with very few small white patches that may gradually spread over to the body and over the course of several months. So it typically begins on the hands, forearms, feet, and face, but can definitely develop on any part of the body. Most commonly appears in people ages 10 to 30 years. Vitiligo is not really painful, but you can get painful sunburns on the lighter patches of the skin. And it is very important to protect yourself with sunscreen, as we always like to stress. There are some treatment options. However, there is no permanent cure for vitiligo. The goal of medical treatment is to create a uniform skin tone by either restoring color, which is repigmentation, or eliminating the remaining color, which is depigmentation. Treatment is customized to address each patient's unique situation. Those treatment options are geared towards restoring lost pigmentation and creating even skin tones, which is repigmentation. Some patients choose to use at-home products like concealers to restore natural color, but this is not usually a good long-term solution. Yes, so that is a little bit of my introduction part. That is an extension from our first workshop. We're decolonizing dermatology part 1. And I've added some important, interesting information, and some were just a recap. However, now it's the time that we've all been waiting for, which is our guest speakers time. We have Chidiebere Ibe presenting today for us. Just to give a quick introduction, you might have known him, a Nigerian medical illustrator and a professional among the few in Africa. He's the creative director in the Association of Future African Neurosurgeons, AFAN, Young Continental Association of African Neurosurgical Societies, YCAANS, and creative director and chief medical illustrator of the Journal of Global Neurosurgery. He is also a junior committee member of World Federation of Neurosurgeons, Global Neurosurgery. Chidiebere Ibe is passionate about contemporary illustrations of Black patients. He hoped to pursue a career in pediatric neurosurgery and establish an association for Black illustrators. We want to warmly welcome him, and we want to now hand it over to him for his topic. Chidiebere, if you are here, why don't you unmute and carry out the presentation from here?
Hi, everyone. Thank you for having me today. And Yeah, wonderful presentation there, and it's good to be here today. I hope you can hear me, right?
Yes, we can hear you, definitely.
All right, fantastic. So I'm Chidiebere Ibe, and I'm medical student and aspiring pediatric neurosurgeon, and of course, I'm a Nigerian Medical Illustrator. And first of all, I'd like to commend PA Foundation, PMA Foundation for what you're doing out there. It's a great stuff you're doing out there, providing these resources and also this body of knowledge to people out there, and it's something good. So today I'll just be sharing a couple of body of knowledge with you all, and I'm going to keep it very short so we can interact, because I love interactions a lot. So I love questions and answer, and I love questions and contribution also, so we could talk from there, and it's good to be here today. So next slide, please. All right, so today I'm just going to talk about myself, and then from there, I'll talk about what went wrong, because I mean, today's conversation is decolonizing dermatology, and how representation matters in medical illustrations. And I'll also talk about why it matters and what we can do, because in as much as we are sharing this information, it's also important to know what can we do to solve this as an individual or as a community. What can we do to remedy a situation like this? So this will be my content, and I'll just be elaborating more on this. So as I earlier said, I'm Chidiebere Ibe, and I'm a Nigerian Medical Illustrator. So much has been said about me, and subsequently, I'll answer questions about that. Next slide. All right, so amazing to know. So implicit bias, I want us to take a deep thought about what implicit bias is. So implicit bias is actually the unconscious prejudice towards individual, towards a person, or towards a group of people, or towards a community. Now, in the slides here, you see that the word unconscious has been bolded, and that's the word I want us to pay key attention to. Because now, for us to decolonize dermatology, for us to speak about this problem, we need to understand what is the root and where did the bias coming from. Now, it's amazing to know that the society today has an approach to people of color, which is unconscious. And the question is now, why is it unconscious? And it's also, so before I explain that, if I talk about that, I want to talk about the DOL test. So most of you here who have heard about the DOL test, the DOL test was an idea that came up in the 1940s by psychology, a couple by name Kenneth and Memia. So this couple came up with a test to test Black people, Black children, of their perception towards their color, or what they felt about themselves. So this test is two dolls is being kept, a black and a white doll. So the white, of course, is the Caucasian skin, and the black are the Africans. So the Black children were asked to identify which of this color, which of this doll has the positive energy, or has a good characteristic. And the Black children pointed to the white doll. And we not ask which of this doll has the negative perception, has negative characteristics. And the Black children pointed to the black doll. Then the research went on to show that when the children were asked, which of these dolls has your skin color? And they said it's the black doll. And yet they had a bad feeling about that. Now, that is to tell you how implicit bias has cut deep down into the system, that we no longer appreciate our skin, no longer appreciate our color. Now, for us to debunk the concept, or to break down, to decolonize the concept of dermatology, we must understand the root, or must understand what went wrong for us to figure out, for us to solve that. And it's amazing to know that the entire part of implicit bias is that it is involuntary. So your approach towards a patient, or your approach towards a person, is with bias, but you can't really tell the essence, or you can't really tell the cause of your prejudice towards this person. And that's because the system from the onset was positioned in a way not to very inclusive. And I'm glad that foundations like PMA foundations are coming up to speak up for things like this, that, I mean, people should be very inclusive. And that's the essence of today's conversation, that we should debunk the concept of debunk the concept of being biased. And also, you know, the fact that if a patient, because this is a health talk for patients, if a patient senses implicit bias in a doctor or doctor communication with doctor-patient communication, the problem is that the patient does not have this safety or this safety to go to the doctor. So this is a lot of issues that had gone wrong. Now, research now found it out that the root to the implicit bias was that from onset there've been segregation, and our school system was built in a system, in a point where the black and the white had different views, had different perspectives. So because this was built up from the onset and there was segregation from the onset, from inception, this built upon an implicit bias, so that children grow up not valuing themselves, that children grow up just knowing that anything black is unbeautiful, that anything black is not nice, that anything black is not to be valued and respected. And this has been the concept, and this has been the unconscious act that people have been living in. Amazing to know that this has affected our health sector also, that doctors also, the approach to black people or the people of color, that the black people are strong enough and that they could take care of themselves. That is bias picking up, and that is an unconscious prejudice showing up itself there. And actually, because of this conversation, we would get to know what we can do as individual, as a person, to change it. And it's amazing to know that because of this implicit bias, that some health professionals has found it difficult to share health information with patients, simply because there is the prejudice that black people are illiterate and black people do not go to school and will not be able to understand health terminologies. Fine, that's great. And that's the bias in there. So this is why I had to start with what's implicit bias, because that's the root. That's where people have unconsciously approach a group of persons with a particular mindset, a particular perspective, and that has affected our healthcare system, that has affected our education, that has affected innovations, because the root of all of these, or the future of these, are innovations that are very inclusive. And so this is the start, and going to start. Next slide.
What starts?
Next slide, please. Fantastic, thank you. So I highlighted here that in healthcare, representation and inclusion are so important, and that providers can understand patients better and deliver high quality care to them. And of course, healthcare system can also advance and have a better outcome. Now, this would be the outcome if the subject of implicit bias hadn't cut deep into the system. It's amazing to know that, for example, when my drawing went viral, when the black features illustration went viral, it's amazing to know that people submit arguments that there are no black fetus, that all fetus are born white. So amazingly, that an African person would give birth to a white fetus. Now that's how implicit bias has cut down into the system, and this is why we are here to talk about why does it matter, or why should it matter? Because people arose with questions. Why do we have to include black illustrations? Why do we have to draw black people? I mean, we're okay with white illustrations. Fine, it's amazing. It's amazing to know. But this is why we are here to talk about why it matters. First of all, that it would breed a more compassionate care. And because we are working as healthcare providers to better our healthcare and to make our patients more safe and more secure with us. And if our approach is not to build compassion, is not to build care, then it is, of course, wrong. But if we are able to represent, they're able to make illustrations that are more representative, that show people, that show black people, that show the Asian, that show the Hispanic, there would be more compassion. There will be more compassion towards caring for people of color, and also, and this will breed an experience for empathy, because you see, there's this concept that black pregnant women are very strong, And because they are strong enough, they do not need medical attention, they do not need medical care, they do not need respect or value. That's a concept, that's the mindset that has been built upon by bias. And that's why representation of Black people matters, because once this experience is built upon, people now see themselves. Once this experience is built upon, it creates an empathy for the opposite. Now, of course, I mean, people have a lot of decision, a lot of things people say that Africans are illiterate, Africans do not read, Africans do not, a lot of things. But that's why these drawings matter, because when people begin to see these drawings over time, they begin to see themselves, and this also results to building a better relationship. Because in as much as patients and a patient wants to receive good healthcare, wants to receive attention, he wants to have a good relationship with the healthcare provider. He wants to be able to know that, oh, am I secure, or am I did, or am I am I receiving good healthcare, or would I receive best advice from this healthcare provider? This is what these drawings do. This is what these drawings are able to do. And subsequently, I will talk about in detail how the drawing can affect our education or our healthcare outcome. And also, thirdly, it will drive innovations. It's amazing to know that the drawing of Black people is an innovation, because whatever is an innovation is something that has never existed before and is being done. That's an innovation. And this is the change that will happen. And now innovations that you all know that innovation would one, drive a change, would two, create an economic value, and that's what the goal is. So everything is tied down to inclusivity and being diverse. And also it's also increase engagement of people, because it's amazing to know, I tell you that, for example, for here in Africa, community health workers, people who go to communities to advocate and to speak for, safety from a lot of skin conditions, a lot of like malaria or sickle cell, a couple of that. Now, most of these public health workers go to rural communities, to patients who can't speak proper English. And the drawings that are taken to those rural communities are drawings of white people. I mean, there is so much of a bias and there's so much of a communication gap there. And of course, there is no engagement there. People do not feel there is a need to listen to conversations like this. And that is the problem. And that's the problem. But if this is why these drawings matter, because as a system, or as a system of health providers, we are working towards improving our health care. We are working towards having universal health coverage. But if our approach to having universal health coverage is not very diverse, it's not very inclusive, then I think our approach is taking the wrong direction. Because if we are working towards reaching out to people in local communities how they don't have access to good healthcare, and the approach is not inclusive of them, then I think the approach is wrong. And also, this would improve our reputation. Now, amazingly, for foundations like PM EST Foundation, what you guys are doing out there to speak up for skin conditions like this, this would improve your reputation, because you are seeing a problem, you are advocating for the problem, and you are creating solutions to that problem. Because it's not just good enough to see a problem, it's also important that you create solutions to that problem. And amazing to organizations out there who are advocating, are speaking up, who are doing amazing things out there to speak up for this, because that's just it. And when people like PM EST Foundation come, people like those listening to people on this now come together, working together, this would result to a very good healthcare outcome. Now, it's amazing to know how drawings can affect healthcare outcome. Yes, of course it does, because the foundation for this is that education be very inclusive. Now, I said, because when we talk about inclusivity, it starts from the educational system. Our medical textbooks, are Black people included? Of course, very little percentage, about 4.5% of dermatology textbook of textbook generally carry Black people. Amazing. So what a striking statistic. And this is why, but if it is drawing in medical literature, in public health materials, on the internet, patients are now more secured, patients are now more engaged, patients will now have reason to have a relationship with their doctor. When they're asking conditions that they don't have knowledge about, they could go to that patient, to their doctor rather, and seek for advice. When now, for example, drawing went viral, I actually had a mom coming from the US. She said that she gave me a story that her child had a skin condition, and she took the child to the hospital to be diagnosed. And because the doctor had no experience of how this condition looks like on a black skin, he misdiagnosed the patient, and the condition got very worse. And that's the striking thing about that, because if we are working towards giving a good healthcare to people out there, and the foundation, which is drawing these things, making these drawings in textbook, so that medical students like you and I, or those out there, could pay reference to these things and become better at diagnosing, better at understanding how these things work, will be able to diagnose and not refrain patients from receiving that healthcare. So this is why these drawings matter. This is why these drawings are important. And of course, when these drawings are integrated into our system, the healthcare outcome would, of course, be better. Next slide, please. Yes, so this come to what can you and I do? Because for most of my so far, I have talked about that this is no longer a one-person project. It's no longer a project that PM Foundation should do alone. It's something that you and I could work together to change it. It's a narrative that you and I could lend our voices to change it. Now, it's amazing to know that about 30 million uninsured Americans, that half of that population, half of that people of color, are people of color who are not insured. This was a research done by the Brooklyns. This is a result of healthcare disparity. And disparity is just the bias in healthcare, in healthcare services. So the question is, what can you and I do as a person to debunk the concept of dermatology, now this is cut across just dermatology. This is about inclusivity. This is about being diverse as a community. First of all, we must increase the health literacy of affected community. The affected community is the Black people, the Asian, the Hispanic. These are people who are affected, who do not receive equal health care as the white people. And how can we increase the literacy? I'm an African person right now. We create educational system. We create a system that can educate these people. Because education is the frontier for creating this change. But when you educate people on the need for this, the change will be driven. Secondly, we raise awareness among health providers. Now, some organizations, what they do is they do some tests to their employees and say, oh, if you had a situation of a direct patient, what would be your approach to this? Cases like that are how we can improve from a little field of influence. Now, for those who are educationists, for those who are in the educational sector, who are teachers, who are professors, and in your class of conversation, it's important that you begin to raise awareness of this, because as I talked about implicit bias, where there's an unconscious perception of people towards a particular of a person, towards a particular set of people. And for you to debunk a concept, for you to decolonize a concept or a mindset, you will be able to base that information with the superior information, which is that the superior information is that everybody deserves to be valued and respected. And that's how we change the narrative. That's how we build the change about, and also advancing health equity. Now, health equity is not health equity. Now, equity is that everybody deserves quality healthcare and deserve access to healthcare. And that's why nations, the World Organization, that's why they're working towards. And that's what we can do. We can build systems like this that can give everybody that healthcare equity. And also provide more resources for this. For example, in my journey as a medical illustrator, everything I drew, everything I learned as an illustrator, what I taught myself. That's because in the journey of learning, I saw that there were no white illustrations. I had to work towards addressing that as a person. It was difficult for me. So for us to make the change, for us to debunk the concept, for us to decolonize dermatology, we must be able to provide resources for people to pay reference to textbooks that are more inclusive, textbooks that are on Black people, textbooks that represent skin condition of Black people, where people can pay reference to. That's what we can do as a system. And also what we can do is to partner. Because the thing is as an individual, the change does not stay with me alone. But if I can partner with people like with foundation like PM Foundation, foundation like the United Nations Foundation, like UNICEF, to create resources, to create materials that can debunk this concept, that's how we can make the change. That's how we can drive the change, and also we can track results. It's also important that in as much as we are driving the change, we were able to keep track record, we're able to keep results, able to keep data, so that we can fall back to that and say, oh, from now to here, what have we been able to achieve? What have we seen? And with this data, what can we do? How can we work towards creating more of these? And that's why we need tracking results, because you must, for you to know they are making progress, you will be able to see results and be able to fall back to those results. Next slide, please.
Hello.
Fantastic. So now this I'm climaxing my presentation now. Now this is a picture of COVID-2 on the black skin. It's amazing how how the representation looks differently. And this is on the white skin shows a Caucasian teenager, how representation looks, how the COVID-2 looks like on the toe. Shows a Southeast Asian teenager, and this is how the COVID-2 looks like on. It's amazing to know that this is the reason why representation, black drawings matter, because as a doctor or as a dermatologist, it is difficult or it's close to impossible that you are able to diagnose this without the body of experience. See, imagine your years in medical school, you had no idea on how to diagnose these conditions. And a patient comes to you with this, and you are unable to give proper advice or proper diagnosis on these. Of course, cases like this can get worse, can grow into becoming worse. That's because the body of experience is not there. So this is why black drawings, black illustrations matter. Next slide. Awesome. And this is the drawing I did, the drawing on the right of African child. This drawing shows a child with chickenpox. This is to show the disparities, to show the difference of how how chickenpox looks like on a white skin and how it looks like on a black skin. So this is just to show why representation matters. Next slide, please. And this is a case of eczema lichenification. This is how it looks like on a black skin. It looks scaly, it looks dry, but without red pigmentation. And for these on the white skin, shows a lot of red pigmentation, looks scaly also. And it's amazing to know that in Nigeria, we have a season called Harmattan. The Harmattan is the season where the weather becomes very dry and your skin begins to crack up. Your skin exactly like the black person here. And you could misdiagnose that to say, oh, it's just a Harmattan period. Maybe that's how the weather looks like. But you could, but this is a condition. This is a typical representation of eczema of a patient with lichenification. So this is why the drawings matter. When drawings like this are being built upon, are being very inclusive, there will be better healthcare outcome. People will be, patients will be represented, patients will feel more safe. Our medical students will have more reference, will have more knowledge about some conditions, and not just for those in health sector. Black people, the people of color, will feel valued and respected. And coming to the end of my presentation today, this is more of a call to everybody out there that for this to matter, for this to work, for this to happen, it's a job for you and I. It's a job that you and I can come together to make this happen, to speak up and to create more of this, and then the change can begin. Thank you for having me.
Thank you so much, Chidiebere. That was an amazing presentation. We learned a lot, like it opened eyes for us, like really, like it was very well worth it. And we were very happy to have you here today presenting for our attendees as well, and especially for me as well. It was great. Now we really want to, like, you're getting so much thank yous in the comments if you want to see. I hope you can hear me well. Okay.
So yeah, I'm going to answer the question now. Hope you can hear me now.
Oh yes, for sure.
All right, great. So what inspired me to become a medical illustrator was a lack of representation. I mean, I started drawing last year July due to lockdown, and being that I'm a self-taught medical illustrator, I realized that most drawings were in white skin. So I decided to work towards changing that. I decided to start working towards changing that, and I would say that's been a very difficult journey, but I mean, it has been worthwhile. Yes. So that just because I wanted to create drawings that represent people, and that's what really inspired me to do all of this.
Thank you. The next question we have prepared is, are certain diseases affecting ethnic people more?
Yes, there are a couple of diseases like, I mean, I had touched it earlier, cases like sickle cell diseases, okay? They are more predominant in Africa than in the white people. And, but sadly enough, there is no representation of sickle cell patients on the black skin. I haven't seen. So sickle cell is actually a serious disease that is predominant in Africa.
Okay, thank you. The next question we have prepared is, how can we train healthcare professionals effectively?
Okay, so how we can train that is to make our resources for training very much diverse. Now, as I earlier said, that the foundation to making this change is our education. And for every healthcare professional was once a student in training, was once a medical student in training, was once a nurse in training, was once a dermatology in training. And for us to train them efficiently or effectively, we'll be able to provide resources enough, because we are training them to give better healthcare outcomes. We're able to provide resources enough that can improve their training. And those are resources that are very much inclusive. Because you would agree with me from research, as I earlier said, that only 4.5% of drawings are Black people in medical textbooks. And that's to say that our training of health professionals is not that effective. But if we create resources, because I'm so keen about that, if we create resources that are able to provide these healthcare professionals with the body of experience that they need, I believe that we can train them for a better outcome.
Yes, thank you. The next question we have prepared is, how does it feel to see the impact of your work?
Well, I feel good. I feel blessed, and I feel very normal. I mean, people think I would just, I just feel my normal self, because it has been the one goal I was working towards, to see that our textbook become very inclusive. And I'm happy to see that our textbook, or I'm happy to see that the work out there is going out to the community of Black people, of white people. And I'm also optimistic or expectant that the change will not stop here, or that it doesn't just end here, that in as much as the work has impacted the world already, that the change will be driven, that the change would keep on going. And that's the goal, and that's the priority.
Thank you. And the last question we have prepared before we answer others' question is, what kinds of implications do you think a lack of equitable healthcare provision to those with different skin have on people, both mental and physical health?
All right, thank you for this. So first of all, I'll start by the implications of mental health. Now, when the drawing went viral, I had a call, and someone said that, so this mother said that she showed the drawings to her younger children, to her toddlers, her teenagers rather, and the children said, strikingly, they said, "Oh, now I see myself. Now I can study." It's amazing to know how just skin condition have been able to influence people's decision to study. And that's because they are able to see themselves. And this has affected their mental perception about themselves, because the thoughts that black is not beautiful, that black is not healthy, the thought that black is not to be respected, has conditioned people into segregating themselves, into pushing themselves, into not being inclusive and feeling that they are of low of value. This has been the effect. This has been the mental situation when if these things are, if there's lack of equitable healthcare provision. Because when you go to the hospital to receive healthcare, the approach that the physician or the doctor gives to you is not the same that you give to the white person, and you feel less of a person, you feel insecure, you feel unvalued, and of course you wouldn't want to go to the doctor for the next prescription or something. And that's boiled down to physical health care. Because, for example, we've talked about how a lot of patients have been misdiagnosed because their doctor or the healthcare wasn't equitable enough to show how these things could be addressed. And because of these, a lot of conditions have got worse, and they were not and couldn't be addressed. So these are the implications of lack of equitable healthcare provision. People are insecure, people are unsafe, people feel less of themselves, the healthcare outcome deteriorates. And it's amazing to know that there is so much, there is an increase in maternal mortality rates, and there's an increase in infant mortality rate. That's because there is no equitable healthcare provision in areas like this. And that's something sad to say. So this has affected our mental perception, and that's why when the drawing went viral, people say, "Oh, in my entire life, I had never seen a drawing like this. In my 54 years in the healthcare sector, I had not seen a drawing like this." And that's so far how the lack of this equitable healthcare had made people condition themselves that things like this do not exist. And it was amazing that we've seen that for the very first time. So things like the implication of this is that it just makes people insecure and devalued.
You said it's very true. A lot of us are agreeing here, even in the chat. And thank you for answering our team's question. We do have some questions, I'd say like one or two in the chat. Why don't you also go and tackle them? So the first one is, what about albinism in our cultural content? Many societies still stereotype them while families break up because of this inheritance. What strategy do you think must be adopted for social inclusion?
Yeah, so for albinism, and it is something I've been working on, and I'm working towards creating a textbook that shows skin conditions on albinos, because their skin is different. Okay, and for people who have wrong perceptions about albinos, it's just a condition that for example, for vitiligo, where there are low pigmentations in some areas of the skin, where it's pretty much looking like the same as an albino. But if we are working towards creating that, we're working towards addressing that, it's important to know that, and that's why research is important, I would say, because cases like these are not information that has been there for a long time. It's not something that we already know, and that's why research is advised, because that's how we can work towards changing that. And I must say, when I hit that question, I was actually smiling, because it's something I'm working on, and it's actually going to be very difficult, because I realize that a lot of these conditions represent differently on albinos also. Of course, and we also need to represent things like that. So something that I'm working towards, and with too much research I'm making, and I hope I'm able to address that. Yeah.
Thank you so much for answering that question. We also have some very important comments in the chat as well. We have another question asking, I would say, could have this as our second last question. What is your perspective on genetic disorders and their physiogenial differences? I believe illustrations like yours would benefit this a lot.
Okay, for disorders, I mean, it's something to think about. And as I earlier said, most of these drawings are not very inclusive. And recently, I have been working with a couple of groups in the US, which is the International Center for Genetic Disorder. And what we did was to show, or what we did was to show how genetics, okay, how genetics ties down to ethnicity, how some people in ethnicity has some defects, some disorder. And so in regards to the face, I would say, because most times the face or the face of expression is, or the point of expression is the face. And I mean, pretty much, I mean, I had a lot of what I say, suggestions of what to create, of what to do. I will just say, I'm just human, okay? So I have limited perspective, I have limited area I'm trying to develop. So, I mean, people say a lot of things that should go into genetic, that's decisions, but I have what I'm trying to address, and that's the goal. So pretty much, I mean, something to reconsider over time.
Yeah, you've already done like very amazing work pertaining to dermatology. So we're very proud of that. We have one last question before we can move on to the other parts of the workshop, which is just wrapping up. The question is, do you have any particular med textbooks to recommend to fellow medical students that have more Black representation in their images or illustrations? I want to sort of answer this in a way that Pyramid Foundation have been developing a lot of resources related to patients and also health providers that would have a lot of related resources. So we have listed related medical textbooks with more of Black representations in images and illustrations. We will be sharing that towards the end of the presentation or workshop, and you're more than welcome to go to the Pyramid Foundation website, and there will be resources that had also been translated in more than, I would say, 5 languages. So it is very helpful. So you feel free to go and check that out. But Chidiebere, you can also answer that question about any medical textbooks that you are aware of.
Okay, yeah. I'm currently aware of I don't know, it's not more like a medical textbook, it's just it's a handbook. Okay, it's called Mind the Gap by Malone. And yeah, I stumbled upon that some weeks ago, and it's amazing because it shows a lot of skin conditions. Actually, they are not actually illustrations, but they are real pictures of patients with those conditions. And I mean, that could pretty much help as a reference point to medical students. But I would say I haven't really encountered a lot of textbooks that are very inclusive, that shows a lot of this a lot. But I mean, as pretty much as what you said already, that PMA Foundation has a lot of resources to give out. But I would say for those who are in dermatology wants to make reference to those textbooks, I would advise you to go search for Mind the Gap. Okay, it's a handbook written by Malone, and it's pretty much amazing. And for me personally, I'm working on my own textbook, and by next year it should be out next year. And yeah, I have more of that coming up. And so I'll just let I'll let the audience and let people know that it's already out there. But pretty much, yeah, that's it.
Thank you. We want to congratulate you for your own book as well. Thank you for spending your time with us for today. Yes, we can read for your textbook, and we really want to congratulate and thank you for showing up for today's workshop. It's really our fortunate that we're having you today here, and you're more than welcome to sign up from here on, or just stay till the end of the workshop today. And we really want to thank you again as well from Pure Medical Foundation.
Thank you.
Yeah, we want to thank you and move on. So we were going to do a group activity, but pertaining to time, it seems like we may not have enough time for that. But I do want to share this link for you to browse through the different conditions listed in the and the images provided for each condition. We were going to take the opportunity to be actively aware of the relative prevalence of dark skin versus white skin, and then you would have been asked to attempt to find images of the conditions you look at on dark skin, and while doing so, discuss experience with racism in dermatology. This would be a fun little activity, but like considering time, it seems like we don't have enough time. We'll come back to this at the end if anyone wants to go over this activity, but I do want to move on. Yeah, so these are some common conditions that I was going to show, but we did cover some of them. We have some additional PM Medical Foundation events and opportunities that I want to get to. So we as part of the education committee, we were doing workshops in LGBTQ plus workshop series. So we were planning for 8 workshops in total. So we have started our first workshop in back in December. We will be doing one in January 9th, 5th, and then a week after January 9th. So the week of January 5th, we will be doing about heteronormativity and the pathologization of LGBTQ plus lives. Then workshop 3, which will be providing care for LGBTQ plus patients. Workshop 4, which will be providing care for asexual patients. Workshop number 5, which is specifically looking at providing care for transgender and non-binary patients. Then workshop 6, which will be specifically looking at providing care for 2 SLGBTQIA youth. And then workshop number 7, which will be providing care for older 2 SLGBTQIA adults. Then workshop number 8, which will be intersectionality, and 2 SLGBTQIA health. This is in a series, so we really ask you to take part in any of these workshops and get benefited from this. So we would ask you to, I'll put this link in the chat soon. This is how you sign up for the upcoming workshops in PM Medical Foundations and get benefited from these. We also have some amazing resources for providers and patients that have been translated, as I've already mentioned, related to health equity, immigrant health. So we have done a past workshop on interim federal health program and how to navigate that, because it is a little challenging for immigrants. So we do have resources related to that. We also have our recording from that previous workshops in our Pure Medical Foundation website. Please feel free to go check that out under resources. We also have the current LGBTQ plus health and racial equity resources as well. Yes, we don't forget to check out the amazing resources regarding dermatology, the ones that I mentioned previously for both patients and providers. It's under the topic of guides on skincare for dark skin tones, and skincare for dark skin tones, a guide for healthcare providers and students. If you're interested in resources that had dark representations or illustrations, feel free to take a look at this resource to find more information and get benefited. Yes, and don't forget to follow us on Instagram, Twitter, Facebook, and LinkedIn at PM Med Foundation to stay up to date regarding upcoming events, resources, opportunities, and workshop sessions. It is very intuitive, and hopefully you all have liked this current workshop. And pretty much that's it for today.